A very warm welcome to you, sir. I would also like to welcome all of those listening via live stream, including members of the American Public Health Association, PAHO, who are having a conference in November on climate change, and PAHO will be leading a couple of sessions at that conference. The recent hurricanes in the Caribbean are poignant and painful reminders of the critical importance of climate change to health in our region. Many of us here at PAHO, and of course many of you participating in the conference, have family and friends who were directly affected by the hurricanes, and some of you may have been directly impacted. And I think all of us feel concerned and disturbed that these extreme weather events seem to be part of, as our director is saying, a new normal. The health sector is a key part of the response to these and other disasters, and as I speak, PAHO is supporting countries to restore health services on the islands that were affected by Hurricanes Irma and Maria. But in addition to responding to disasters, all of us in the health sector have the responsibility to advocate and persuade our governments to do what we can and what we must to reduce climate-related health risks, adapt to climate change that has already happened, and urgently accelerate preventive actions to reduce the emissions that will make it worse if we do nothing. Climate experts warn us that extreme weather events will only increase in intensity as the oceans continue to warm, sea levels rise, and storm surges increase. There are other insidious ways that climate change is threatening health in the Americas. For small island states in the Caribbean, these rising sea levels, storms, flooding, and erosion are no less than existential threats. And we've seen that on the island of Antigua and Barbuda. We know that Barbuda, everybody was evacuated, and that's the first time in 300 years that there are no human beings on the island of Barbuda. So these are truly existential threats. In Central America during 2014, 500,000 families in El Salvador, Guatemala, Nicaragua, and Honduras suffered food and water shortages because of a prolonged drought that was made worse by climate change. In North America, wildfires have led to more than 120,000 people displaced in Canada and billions of dollars in economic losses in the United States. In South America, recent outbreaks of Zika and yellow fever and expanded areas of transmission of dengue, chikungunya, and West Nile virus should all raise concern about the potential of climate change to increase the risk of epidemics. So climate change is very real for our region. And the health sector can play a critical leadership role by bringing together the sectors necessary to address and prevent climate change and health risks, including agriculture, tourism, energy, and transportation, and by engaging multiple levels of government, from policymakers at the national level to the local level, where many initiatives start, such as the Healthy Cities Initiative, as well as engaging civil society, young and old alike, in this effort. We also have to work with sectors to mobilize international resources. And PAHO is supporting our member states through a plan of action on climate change. We've prepared training materials to help countries develop vulnerability and adaptation assessments. In October of this year, PAHO and CARFA will provide training for the countries of the Caribbean to develop health chapters of their national adaptation plans, and we have plans for trainings in Central and South America next year. We've published or are preparing 10 country profiles that will be launched at the next UN Framework Convention on Climate Change. We're supporting projects in countries such as the Smart Hospitals initiatives, and we are creating and disseminating online courses. So there's much to be done, and we look forward to supporting many more efforts of this kind, and to working together with you and to hearing from you about how you think we can work together. Now let me introduce our panelists. To my, I've introduced Dr. Tedros already, our Director General. To my left, the Honorable Miguel Mayo, Minister of Health of Panama. We have the Honorable Angus Friday, Ambassador to the United States and the OAS from Grenada. Welcome. Dr. Theresa Tam, from the Chief Public Health Officer of the Public Health Agency of Canada. And Dr. Juan Pablo Bonilla, Manager for Climate Change and Sustainable Development of the Inter-American Development Bank. So welcome. And we will start with Dr. Tedros. You have the floor.
Yeah, thank you so much. So this is food for work, huh? Thank you, Isabel. Thank you, organizers, for inviting me to attend this very important meeting. Honorable ministers, colleagues, ladies and gentlemen, it has never been more clear than in this region, in this moment, that urgent action is needed to address the health impacts of climate change. All countries are vulnerable to the health impacts of weather and climate. Even those that cast doubt on whether the climate is actually changing. We cannot say that climate change alone is responsible for the hurricanes that have ravaged your countries, but we know that it's increasing the temperature of the oceans, which generates more energy and rain. Rising sea levels also make storm surges and flash floods more dangerous. And the intensity of the hurricane is actually increasing from year to year. Although those responsible for climate change are the richest, biggest, and most powerful nations, it's the poorest, smallest, and least powerful who feel its effects. Extreme heat, the spread of vector-borne diseases such as dengue, and malnutrition are among the effects felt on the ground. Every year, air pollution causes 6.5 million deaths. All populations should be protected from a changing environment. This is a priority for WHO, both at the next executive board and in the next general program of work, as you have heard me say earlier. We're focused both on adapting to climate change, but more importantly, on mitigating it. True primary prevention means removing the source of the problem, not just treating its effects. Cutting greenhouse gas emissions is necessary both to ensure the survival of the most vulnerable countries and their people, and also because it can bring very large health benefits. Those who are most at risk should be the first in line for help. At the COP23 meeting in Bonn in November, we will launch our special initiative on climate change and health in small island developing state seeds. This program will involve dedicated staff in Geneva working with regional and country offices to support small island states with advocacy, technical support, and assistance in accessing financial resources. We look forward to working with you all very closely to protect people and our planet. I thank you.
And I'd like to invite now Dr. Miguel Mayo, Honorable Miguel Mayo, Minister of Health of Panama, to provide his remarks.
El planeta puede vivir sin nosotros, pero nosotros no podemos vivir sin el planeta. Anónimo. Buenas tardes y buen provecho, Tedros, Isabella, Theresa, Juan Pablo y a todos los ministros presentes. El cambio climático representa la mayor amenaza para la salud mundial en el siglo XXI. Esta es una publicación realizada por la Organización Mundial de la Salud. Es sin duda una amenaza que nos afecta a todos directa o indirectamente, pero hacerle frente a este desafío puede representar la mayor oportunidad para mejorar la salud del mundo. El clima está cambiando. Muestra reciente de ello son la intensidad y la frecuencia de los fenómenos climáticos en la región, con sus efectos devastadores en la salud y nefastas consecuencias económicas y financieras. Invertir en medidas para mitigar y adaptarnos a los efectos del cambio climático debe ser una prioridad en nuestro continente. La gran disparidad de preparación entre los países en América Latina merece una especial atención por parte de la Organización Panamericana de la Salud y de la OMS. Las zonas con infraestructuras sanitarias deficientes son las que tendrán mayor dificultad para prepararse y responder si no reciben asistencia pronto. Urge mayor determinación política local y cooperación técnica internacional en cómo construir resiliencia de los sistemas de salud, orientar en la preparación, respuesta y vínculos de los sistemas de salud en el tema de la reducción de riesgos de desastres y la adaptación. No olvidemos que el cambio climático influye en los determinantes sociales. La evidencia científica muestra que muchas de las enfermedades son muy sensibles al clima y ya son evidentes los riesgos de incremento de enfermedades infecciosas que no respetan fronteras. Panamá apoya un enfoque de políticas integradas para garantizar el desarrollo económico y social inclusivo y la sostenibilidad ambiental. Presenta un acelerado desarrollo con crecimiento del Producto Interno Bruto superior al 6% en forma sostenida en los últimos años. Este crecimiento económico trae como consecuencia una concentración y crecimiento poblacional notable, sobre todo en las áreas urbanas y de manera no precisamente ordenada. Un incremento en la esperanza de vida al nacer, los cambios de ambiente y otros determinantes sociales producen un nivel de salud, riesgo y retos que se deben trabajar en forma intersectorial y con el apoyo de los organismos internacionales. Con la sanción de la Ley 8 de marzo del 2015, el Estado panameño aborda el mayor problema ambiental global contemporáneo, indicando el diseño y ejecución quinquenal de una estrategia nacional de cambio climático que reduzca los impactos adversos de este fenómeno en los sectores de la economía, haciendo especial énfasis en la población y los ecosistemas más vulnerables. Esta estrategia, de nuevo, se hace de manera intersectorial, con la participación de 27 instituciones nacionales y organismos internacionales. Reconoce, pues, que el cambio climático es una amenaza global. Las desigualdades de salud, los determinantes sociales, económicos y ambientales, el desarrollo sostenible y la reforma del sistema de salud son prioridades identificadas que hacen parte de esta estrategia nacional. Panamá, comprometida con proteger el ambiente y la salud, ha avanzado con la implementación del Convenio Marco contra el Tabaco para promover ambientes libres de humo. En el área de la salud ambiental, el principal proyecto de inversión es el programa de saneamiento de la Bahía y la ciudad de Panamá con un costo mayor de $2.000 millones para recuperar las condiciones sanitarias y ambientales del área metropolitana y ciudades aledañas, así como la eliminación de la contaminación por aguas residuales no tratadas en los ríos que atraviesan la ciudad y las zonas costeras de la Bahía de Panamá. Las metas en salud no se deben limitar a reducir la prevalencia o la incidencia de las enfermedades o a mejorar los servicios de salud. También tienen como propósito reducir las inequidades, incluir la salud en todas las políticas y entender la misma como un componente y un factor fundamental del desarrollo sostenible, tal como se establece en los Objetivos de Desarrollo Sostenible en la recién aprobada Agenda de Salud Sostenible de las Américas 2018-2030. Los países tenemos el gran desafío de apropiarnos de ella y hacernos una realidad, como decíamos anoche. Consideramos que hay que tomar los tres paradigmas: desafíos, prácticas prometedoras y oportunidades de financiamiento, no de forma separada, sino en conjunto. La vieja práctica cartesiana de dividir un problema en partes, si bien sirvió para entender la casuística de los fenómenos, también deja el nuevo concepto de volver a unir las partes para poder resolverlo todo junto. Consideramos importante que los gobiernos, junto a otros sectores de la población, inviertan en investigación sobre cambio climático y salud pública, así como un seguimiento y vigilancia que revelen la importancia de aumentar el financiamiento destinado a los sistemas sanitarios resilientes y al cambio climático en todo el mundo. Debemos preocuparnos por la aplicación de políticas que permitan mitigar el cambio climático y promover la salud pública en los próximos años. Para tal fin, urge garantizar que la salud, tal vez la más fundamental de los indicadores del bienestar, esté de ahora en adelante mejor representada en los foros internacionales y en la toma de decisiones políticas de cada uno de nuestros países. Todos sabemos que el continente americano necesita apostar por la construcción de hospitales seguros que resistan los efectos del cambio climático y garanticen una respuesta de calidad ante los desastres. Extendamos este concepto a la ciudad, al país y al planeta. Aparecerán nuevos costos, pero serán adaptados a la economía. Solamente ver el ejemplo de los actuales eventos climáticos y considerar la dificultad de no tener, por ejemplo, energía eléctrica, ¿se imaginan los hospitales sin energía eléctrica, las redes de agua potables sin luz, las plantas de tratamiento de aguas servidas sin energía eléctrica, los frigoríficos sin esta vital e importante fuente? ¿Cómo se calcula el costo financiero de no estar preparados para un evento como este? Una vez más, hay que invertir en prevención para tener un sistema de salud resiliente. La pobreza y el desarrollo se vinculan con el cambio climático y la salud. Entender mejor los impactos geográficos específicos e identificar planteamientos a nivel de cada sector para superar desafíos que son comunes a todos ellos es una tarea pendiente que tenemos por delante y que debemos priorizar. Antes de traer palabras proféticas de un futuro difícil, queremos recordar que no hay otro planeta cerca donde escapar en caso de que éste colapse. Nos toca resolver el problema ahora para nuestros hijos y las siguientes generaciones. Ministros, el cambio climático es un hecho. Adaptémonos. ¿Qué más tenemos que esperar para empezar a actuar de inmediato? Decía Winston Churchill, nunca me preocupó la acción, sino la inacción. Muchas gracias.
Thank you very much, Minister Mayo. And now I'd like to turn to Dr. Theresa Tam, Deputy Head and Chief of the Public Health Agency of Canada. Deputy and Chief Public Health Officer of the Public Health Agency of Canada.
Okay, so I think I'll do something here. I don't know how to work the slides.
Excuse me, should we go ahead and, sorry, let us start with the Honorable Angus Friday, Ambassador of Grenada to the United States and the OAS. Thank you.
Distinguished ladies and gentlemen, many thanks for having Grenada represented here. It's an honor and pleasure for us to speak about climate change. It's an issue that's near and dear to our heart. I just want to recognize a couple of people in the room. My colleague, Selwyn Hart of Barbados, Dwayne Sands of Bahamas, and folks, it's great to see so many people taking an interest in this issue. What I'd like to do is to share with you a perspective from Grenada, and in doing so to make the point that the best healthcare we can have sometimes is the healthcare we can afford. And so it's very important as we think through the challenges of climate change, as we think through the impacts on health, that we also give some thought to the underlying economic systems that actually support that and allow countries to support their own healthcare systems. And that's absolutely important when you think about the economic impact that climate change has had and is having and will continue to have, particularly on island states. Our journey on climate for Grenada actually began in 2004 with Hurricane Ivan, which tracked unusually low across the Atlantic. And this was unusually low because, of course, Grenada is considered to be below the hurricane belt according to Lloyd's Marine Insurance classification. And so this is not something that Grenadians had expected in 2004. The damage to Grenada was 200% of GDP. We lost 90% of our housing stock and 70% of our homes. Now think about 200% damages of GDP. Compare that with Hurricane Katrina, which was less than 2% of the United States GDP. Hurricane Sandy, less than 1% of the US GDP, but of course had significant impacts themselves. So the impact that you have in a small island states is particularly devastating. What Grenada was able to do from there was to, representing the Caribbean, to take on the chairmanship of the Alliance of Small Island States, where we worked with the Caribbean and with other countries towards the Paris Agreement, which came about in 2015. Now, this was one of the, as many of you would know, this was one of the largest agreements of its kind to be reached internationally, with the islands in particular playing a particularly important role in coalescing a coalition of high ambition so that we could ensure that temperature rise does not go above 2 degrees above pre-industrial levels, and indeed with ambition to keep that to 1.5, as the islands would say 1.5 to stay alive. Many people, Selwyn Hart, for example, in the room here, has really been one of the leading negotiators on behalf of islands, and indeed represented the, worked very closely with the UN Secretary General towards this particularly important meeting. It's important to say, and it would be remiss of me to leave this room without mentioning that the Paris Accord could be in trouble. And while we can make light of the situation, in fact, having countries leave the Paris Accord is not a laughing matter, as we've seen with all of the devastation that we've seen taking place this week. So this is not just devastation taking place, of course, in the Caribbean and in the region. Of course, the impacts are significant across the world on ecosystems, including things like in the Arctic and Antarctic, where we're seeing the largest ice breaks from the ice shelf. So I mention this because it's important that we take all steps to always invite our US partners and colleagues to come back to the table in terms of the Paris Agreement. Because we have a new normal. We have a new normal. The types of events that we used to call the 1 in 100 years event is now happening twice every month, as we have seen recently. This is not the sort of damage that islands in particular can sustain. And we've also seen the damage that this has caused in the United States with the various hurricanes that have struck. So this is having damage across the United States, the independent islands of the Caribbean, and of course the dependent islands of the Dutch islands, the British islands, and of course American islands, US Virgin Islands, and recently Puerto Rico. This is the new normal, folks, and climate change is real, it's happening, and we need to take action. The types of typical post-hurricane scenarios that you see really attest to the fact that we are not prepared. We're not prepared to deal with these annual events that are now a perennial challenge. And these events are having impacts on the lives of people. Following Hurricane Ivan, it was very difficult, for example, to get anybody back to work because people are first and foremost focused on their families, focused on rebuilding their homes, putting back on the roof, etc. When people do not have the basic building block of the household, that has all sorts of implications in terms of health and wellness, sanitation, and so forth. In addition to that, the impacts on agriculture, of course, has further impacts on health in terms of food and nutrition. Prime Minister Skerritt, a few days ago, made an impassioned appeal at the United Nations, giving everyone a sense of the destruction that had fallen Dominica. In his remarks, he talked about Eden being broken. Of course, everyone knows that Dominica is the nature island, but of course there's a real danger that the Eden that's broken is our number one planet, planet Earth, and this is what we need to guard against. There is some good news. The Paris Agreement was a powerful signal which went to the private sector and right across the world, because the first thing that we need to do with climate change, in fact, we need to do two at once. One is to mitigate the impacts, and the other is to adapt. In terms of mitigation, you'll be pleased to know that from 2013, for the first time, investments in renewable energy exceeded investments in fossil fuel to the tune of 143 billion versus 141 billion. For successive years, up to 2015, we've seen an increase in the amount of funding that's going into new builds in renewable energy. And this is important because this is how we actually work to stop climate change. 2016, there was a fall, and it's important that we get that back. In terms of adaptation, housing, again, is one of the key issues, but that housing and the ability for people to protect their homes depends on the underlying economic base. On the left side of this slide is a photograph of Bermuda. In Bermuda, the per capita income is about $75,000 US. People have a concrete roof, and so Bermuda can function the next day. What we see after the Caribbean, and certainly what we've seen in Grenada and what we're seeing elsewhere, is that it's taking months for households to get back on their feet. And there are some very simple things that we could be doing in terms of implementing what those braces you see there are called hurricane ties. And it's a very simple measure that ensures that homes can actually hold on to their roofs. So as we think about healthcare and and the impacts of climate change on healthcare, the first thing to protect is the home, and anything we can do to do more in terms of hurricane ties, where countries do not have per capita incomes of 75,000, but more like 7,000. Putting in these hurricane ties is perhaps one of the most important things that we can do. It's very important that whatever happens, we don't leave the current disasters we're facing. It's very important we go in with the humanitarian assistance, but following that, we need to follow up because we have other challenges. So for example, coastal erosion in the north of Grenada is impacting homes and coastal infrastructure. This is a part of the north of Grenada where we, at Grenada's expense, are having to build a breakwater and other forms of sea defenses to ensure that that doesn't happen. This is a huge cost, a huge tax on the countries. The whole idea of the polluter pays in the international circles on climate change, those things have not properly kicked into effect yet. Yes, we have a number of funds, but funds are still quite difficult to get from some of these arrangements. And I'll refer to those in a moment. What we're doing in Grenada is to develop a vision for the island which looks at two things. One is how can we ensure that our coastal areas, because we're so dependent on tourism, are much more resilient? How can we ensure that homes are resilient? How can we build a vision that ensures that we can have the economic basis for prosperity? And how do we do all of that in a climate resilient manner? We have spent months on consultations, working with communities to develop some ideas for how we can put that together. And as a result of that, we've come up with a master plan which calls for about $1 billion worth of investments across the island. This is an idea that we're taking to the World Bank and to the Small States Forum. The World Bank recently announced a 50% increase in IDA funding. That's the concessional funding from the World Bank, from 50 billion to 75 billion. What that means for small states is that they're getting about a tripling, well, for all small states it's about 1.7 billion, and it's about a tripling of IDA resources. In Grenada's case, what we intend to do is to spend, it's about 66 billion for Grenada, to spend a portion of that money on ensuring that we can have resilient homes so that we don't run into all of the problems that occur after hurricanes. In addition to that, we're inviting, and my Prime Minister as chair of CARICOM has invited all of CARICOM members to put forward ideas and projects, things that they'd like to have financed. Part of this will obviously be relying on the 1.7 billion from the World Bank, but also looking to see how we can work more closely with the Green Climate Fund to attract funds. And because not all countries are eligible for IDA, Grenada has put forward the idea of a $1 billion fund of funds which can help islands in terms of increasing resilience. So I've said all of this to say that it's very important that with the shocks that we're feeling today, we don't walk away from here having had a sort of knee-jerk reaction to see how we can just do humanitarian assistance. This needs to be a sustained and programmatic approach so that we can anticipate these events that are going to happen year after year, and we can be ready. When countries run into a hurricane, when they have a hurricane event, it's important that they know that the next day assistance is coming. But in addition to that, we need to spend a lot of time building up the resilience of countries. So at the Small States Forum, as I wrap up, at the Small States Forum, which will take place on the 14th of October, on the occasion of the World Bank annual meetings, we will be dedicating part of the session to looking at these issues. And finally, the World Bank has indicated that from the chief executive of the World Bank on down to the executive directors are hoping to hold a special session just to look at the World Bank's response to this issue. I think our job in the room as member states is to ensure that none of these efforts are knee-jerk reactions, and that we can have a sustained programmatic approach going forward to ensure that countries are much more resilient in future. Thank you very much.
Thank you very much, Ambassador Friday. I'd like to turn now to Dr. Theresa Tam, Chief Public Health Officer of the Public Health Agency of Canada.
Thank you very much, Dr. Danel, Dr. Tedros. Thank you, PAHO, for organizing this particular event. And I think, as all the speakers have said, this is a very timely discussion, especially given the severe weather events that's been experienced in this region in the very recent weeks. And so my thoughts certainly go out to all those affected. And I think all countries are at risk, I think, as other speakers have said. And so in the Canadian context, climate change is posing an increasing risk to the health of Canadians, and we are starting to see the impact of those risks. So Canada is very big, and we have the longest coastline, so obviously talk about coastal impacts are very important. And we have very diverse ecosystems. There are 4 seasons, and people think of Canada as a very cold country. Well, in the summer, it's actually really, really hot. So it goes from -40 to +40. And we also have very diverse human populations. And like many countries in the Americas, we have a significant indigenous population, about 4% of all Canadians. Many Canadians live at the bottom, the southern part of Canada, but there are also many remote and isolated communities scattered about the country. So this great diversity in ecosystems and population characteristics, along with the changes in the climate that we're observing, For example, we have increased precipitation, heat waves, reduced Arctic sea ice, means that Canadians are faced with a wide range of risks as a result of climate change. And in Canada, the average temperatures have already risen 1.5 degrees Celsius since the 1950s. So the types of risks experienced in Canada are probably encountered in many countries, although the specific scenarios are a little bit different. More frequent and severe extreme weather events like floods, droughts, wildfires, ice storms, and heat waves have direct impacts on health. For example, in British Columbia, there was an extreme heat event in 2009 that resulted in over 156 deaths. There are also other indirect and longer-lasting effects, particularly on mental health. So after a severe flood earlier this year in Montreal, there was some data showing that 3/4 of the residents who had to evacuate their homes experienced mental health problems, concentration, sleep disorders, anxiety, etc. Infectious diseases, as Dr. Danel had mentioned, show the disease vectors, for example, mosquitoes, ticks, and other vectors, their distributions could change, of course, due to changes in temperature and precipitation, which increases our exposure to foodborne, waterborne, vector-borne diseases. Oops. And so air quality, on top of the sort of built environment and emission from fossil fuels, we're also seeing increased forest fires that have significant impact on air quality. And last year in one of our western provinces in Alberta, where there was a very big wildfire that resulted in a mass evacuation of about 88,000 people from their homes, we looked at the Air Quality Health Index as a measurement. And this spiked all over the province, in the adjacent province. And it's usually measured on a scale of 1 to 10. And in some areas, it actually reached 38. So that's a very huge impact on air quality. The north is of particular interest in terms of this topic because the north of Canada is warming at twice the rate as the south of Canada. And there's some very special challenges that face the indigenous populations in this area. And many people have talked about the fundamental social determinants of health. And so some infrastructures are not there. The socioeconomic conditions are difficult. And so as a result of these risks, the populations face dangerous travel conditions, melting permafrost and ice roads, threats to their food security from changing distribution of wildlife that they're dependent on, and impacts on infrastructures that sustain health. So, and in follow-up to the Paris Accord, Canada took a significant step forward in producing a national climate change plan. And so this is a pan-Canadian framework. I have a colleague from Quebec who's here in the audience. So it takes an effort from all levels of government and multiple sectors. And so this is a very significant commitment at the highest levels of governments. And so within this are both the mitigation measures, but also adaptation measures, and protecting and improving human health and well-being is a key of those adaptive priorities. And so this particular framework identifies actions across a broad range of climate change-related health risks, and also the focus on supporting indigenous communities. So in the Canadian context, one of the impacts, of course, that we're concerned about is to the health infrastructure itself. And so with these increasing projections of severe weather events, some of our health systems need to withstand those pressures. And there's many stories coming across Canada in very recent months showing the challenges of evacuating some potentially highly technical hospitals with intensive care units and other requirements. We had a hospital in Regina, which is in the central area of Canada, where some very high temperatures and elevated humidity during the hot days of summer hampered its ability to adequately function. And forest fires and floods have really had an impact on some of our health infrastructures. And so some of the ways that we're trying to address specific scenarios, for example, addressing extreme heat, we've actually worked together. As I say, while Canada is cold, we have some very high and extreme heat days. So here you see some of the types of measures that we're putting together, including expanded heat alert and response systems, but really educating populations through health promotion approaches to focus on the vulnerable populations such as the old and the young, for example, pregnant women, looking at real-time syndromic surveillance systems to guide our response and provide the necessary tools for health professionals and emergency management, and some other areas of interest such as reducing the urban heat island effects and doing some preventive measures in cooling communities. And so we also have research initiatives, some of which are in collaboration with a number of countries in this region. And so I think one of the key areas, of course, is an interdisciplinary research to understand the social, ecological, and health impacts of climate change in the Arctic. And I know that Canada has also been supportive of countries and PAHO in developing climate change and health vulnerability assessments. So I think this is some of the things that we can do collaboratively. So in terms of vector-borne diseases, we've done some projections over time, for example, of the Lyme disease vector, which is the black-legged tick. And the evidence shows that there's really quite a strong direct correlation between the spread of this vector and climate change. And so with those kind of information, we can hopefully prepare populations and instigate preventive measures ahead of time. And so we've also recently established an infectious disease and climate change program with a bit of funding so that we can support communities as they develop ways in which they can protect themselves and look at their own requirements. So in terms of supporting indigenous communities, we have a specific climate change and health adaptation program for the First Nations and Inuit communities, which are community-based projects, recognizing that adaptive capacity varies in each community as well as their unique challenges. I think having a community-centered approach is probably a very good model to look at. The research that we're doing is also, I think, of interest in that it is a community-based approach and incorporates traditional knowledge. The resiliency and the holistic approach that our indigenous populations have and their relationship with nature, I think, has lots of things that we can learn from. They are very resilient peoples, and so I think it's not just a one-way exchange of information. We have to listen to their needs. And we'll be an engaging national indigenous organization as well as local communities. So lastly, there's lots of interest in Canada, and I think we look forward to collaborations with many of you in this room and PAHO. I won't go through all of these. I think both mitigation and resiliency adaptive measures. And we look forward to technical collaboration, for example, with small developing island nations in looking at health vulnerability assessments. So thank you.
Thank you very much, Dr. Tam. And now turn to Dr. Juan Pablo Bonilla, who's the Manager for Climate Change and Sustainable Development at the IDB. Welcome.
Thank you very much, and I would like to start by congratulating PAHO for organizing this event, and special regards for all my colleagues at the panel. And I would like to not emphasize the impact of climate that I think is very clear for everybody, but to share with you what we're doing as the Inter-American Development Bank, including the private group, the private sector of the bank, and how we can work more regarding the agenda with the health sector. I was writing down, I think, keywords that everybody has mentioned of having a systemic, programmatic approach, of having a multi-sectoral approach for climate. And we consider at the bank that that's the main challenge after the approval of the SDGs in 2015 and after Paris at the COP21. Because in general, all our governments are organized by sectors, and that's the way we are organized also. We're a mirror of the governments. And I think the big challenge right now is how to address these issues with a multi-sectoral transversal approach. And if you see Paris from the institutional point of view, the main outcome that we had after the Paris Agreement was to have the NDCs, the National Determined Contributions, presented to the COP, and how they were prepared many times in an agreement at the government level, not only from the ministers of environment, but on the contrary, having a lot of involvement from sectoral ministries and a leadership role of many ministers of finance and planning. And I would like to start by saying that not because they are our governors, but we need to every day more and more work with the ministers of finance and planning to have a mainstreaming programmatic agenda for climate mitigation and adaptation, being able to bring the sectors as part of that. Because at the end, the challenge that the NDCs are putting is how every country will advance in the goals that they had under Paris, not only to reduce emissions, but in a way more complicated part that is how to adapt to climate change. So in that sense, the IDB, the Board of Governors of the bank, at the annual meeting we had in Bahamas, approved a very ambitious goal for the IDB public and private for 2020, and it was doubling the climate financing as an IDB group for 30% in 2020. What that means, more or less our pipeline right now is about 10 billion. Last year, the public sector lending was about 9.3, 9.5, and the private sector was about 2.3. This year, the private sector will grow to 3 billion, and the public sector will be in about 10. So 30% of that by 2020 needs to be to climate finance. Now, we also have an approval from our board of directors of an institutional reform to address climate and sustainability in a transversal way. Many of you mentioned the importance of urban issues, the link of air pollution with climate, with health. It is not free that you have an SDG 11 just related to sustainable cities. We have seen all the issues related with rural issues. It's also the same. You have local pollution issues like pesticides and others, but at the same time you have the connection with global issues like climate and biodiversity. So we created a new department at the Inter-American Development Bank that is the Sustainability and Climate Department, with two big areas that are urban and rural. Under urban, we have all the issues for development of cities in terms of sustainability, inclusiveness, and in the rural part, we have agriculture, natural disasters, tourism, and local environmental issues, with a global area, the Climate Change Division, that is in charge in a transversal way to work with rural and in urban to mainstream climate into both. And at the same time, we have created a sustainable infrastructure group. Many of you emphasize the importance of having resilient social infrastructure in terms of the health system. So we have created with the manager of infrastructure and the private sector of the bank a sustainable infrastructure group, first to define what sustainable infrastructure is. Because it's way beyond climate. It's also including social issues, financial issues, transparency issues. And President Moreno announced recently that very soon we're going to have our own definition about sustainable infrastructure in all the areas. But the unit that we have created for sustainable infrastructure is working with sustainable social infrastructure. We're already in the design of hospitals, schools, including not only renewable energy, energy efficiency, but most importantly, Minister, you mentioned the resiliency component to natural disasters and to adaptation to climate change. So the climate division is leading at the bank the mainstreaming action plan inside the bank, not with the urban and the rural area that I'm leading as part of the department, but we have the mandate to have an action plan for the ADB group that, by the way, we submitted to the board of the bank this Monday. And the plan is how we're going to achieve that 30% target by 2020 in terms of financing, working with all the different areas of the bank. For me, it has been fascinating meeting with the institutional area of the bank and seeing how issues like fiscal reforms are going to start including how climate, how disasters are impacting fiscal accounts of the Ministry of Finance. How in different issues like census that the institutional area is leading, how we need to include questions as part of the lending for census to start having the data needed for adaptation and others. How when you talk to health and education, those divisions are saying, listen, this is the key area that we need to include. And with health, there are two key areas that we need to advance in the next 3 years. The first one, as I mentioned, is infrastructure, but the second one is knowledge. Is how to know better what are the impacts of climate. Minister, you mentioned malaria, dengue, and others. Is not only to know those impacts, but also to foresee what kind of technology and innovation you have to advance different solutions. This morning we have a meeting at the bank with Singularity University, and it's amazing how exponential is technology moving. You mentioned solar. In India this week, we had a new deal about solar at 3 cents per kilowatt hour. Nobody. We saw the predictions in the last 10 years, predicted that solar was going to be able to go that down. And at the same time, if you start seeing how innovation can support disaster relief, I was amazed to see the images about 3D printing. In countries like China, they're already printing with 3D almost apartments. I asked if there is a 3D printing technology already for disasters, and I found that there is an organization already working about small hospitals, schools, housing, in a very fast way for 3D printing. For me, that was fascinating to see how exponentially that is moving. So technology in general and innovation is going to be also part of the answers. But going back to the NDCs, what we are doing internally at the bank, I explained to everybody, listen, our NDC is that 30%. And what I'm expecting from any division of the bank is to ask themselves how in any project that the bank has, we can include climate as a component. By definition, I'm saying at the IDB, we don't have climate change projects. We need to include climate as part of the design of the projects for mitigation and adaptation. So if you have a reflection of that at the government level, I think, Minister, what should be maybe asked from the health sector is what can I do in my sector that is part of the NDC of the country to then talk to finance, planning, or environment and say, listen, why don't we do this together? Because that's how the resources come for having concessionality and others. We have been working with the Green Climate Fund and others to have concessionality. We have advanced a lot in Latin America in renewables, in particular transportation. We have Canada is our main donor. We have the Canadian Climate Change Fund inside the IDB. It started with $250 million. We're in the process of replenishing. But the way we use the Canadian fund was to blend the resources of the bank with the concessional resources that we have from Canada to do wind, to do solar, and the pipeline that we created has been plenty of innovation in different countries, from Mexico, Nicaragua, Salvador, Uruguay, countries in the Caribbean. Unfortunately, as you know, we only have 6 countries of the Caribbean that are members of the bank. But at the end, what we've learned from energy and transport is the need from concessionality resources now to go further for agriculture, and it's going to be key for adaptation. Without concessional resources to do that blending, and that's why I put the example of Canada, it would have been able, the bank, to really advance in the areas of energy, for example. Now, for adaptation, we need to start thinking how to bring the concessionality and do that blended of finance to the component of adaptation and resiliency. I think that's going to be the next step for the last year. Just to close, I'm more than happy to share with the team of PAHO what we're doing with the health division. But beyond the financing that we do as a multilateral, we also have the knowledge products. Every year we define key areas for development in the next years for research. I think, as many of you mentioned, the vulnerability assessments and the impacts could be a joint effort that we can work together. Thank you.
Thank you, Dr. Bonilla. I think we've heard some very stimulating presentations. We've heard from 3 of our countries about how climate change is affecting them, what they're doing, what they're planning, the future, and some strong thoughts on financing and some of the thinking that has to go into exactly how we prepare for the future. Before we start opening this up to your interventions, questions, comments, I'd like to invite Dr. Etienne, who is here, to come to the main table, please. Yeah. Our director for the next 5 years. Would you?
I was very happy in the back.
Dr. Tedros is leaving, so before are there any questions specifically for him? Any questions for Dr. Tedros? Is there anything we want WHO to do?
Okay, thank you for this opportunity. My name is Thelma Philip Brown. I'm from St. Kitts and Nevis, which is in the Leeward Islands, Hurricane Alley. And sessions like these are really important to me. But one thing that has stuck out in my mind, and Ambassador highlighted it, that at all these events there's an elephant in the room. Dr. Tedros highlighted climate change. Dr. Carissa highlighted climate change. And for us small island developing states, it is absolutely essential because it speaks to not just our health, but our sustainability generally. And yet, as Ambassador pointed out, there is a divide because the most powerful country in the world is not at the table. And I think he's absolutely right. We need to find a way. And so I want to know, Dr. Tedros, if we can find a way to get that country to the table. Yesterday I was in a meeting on global health, and ExxonMobil was there. Again, it was global health, but there was the elephant still in the room. We won't touch climate change. And I asked them about that, if they're doing enough to help to bring this country back to the table. There's an old saying in the Caribbean, joke to man is death to monkey. This is like death for us small countries, and we need to find a way. He said yesterday that science is calming. Martin Luther King said that science is about facts, religion is about values. Obviously, for the climate deniers, it's not calming, and I'm not sure what it is, but we need to find a way. Catherine PAHO, she's an evangelical Christian and a top climate change scientist, said that we have to make the argument first with the heart. And so I'm asking if WHO can help us as small island developing states and coastal states make the argument with our hearts, even if we need to change the moniker from climate change. But we need to make that argument, bridge that chasm, and bring that country back together. And last appeal I'm going to make, we can evacuate, and obviously we can't evaporate. So are there any countries that are willing to do, like the Maldives, have us as climate change refugees? Because you know what? Ambassador Friday said that they are not in that hurricane alley. Well, I said we are. Usually Antigua, St. Kitts. You know who else is? Haiti. And I don't think any of us, one of us wants to see a hurricane category 5 barreling towards Haiti, and we don't have everybody in the region at the table. So how can you help us to make that argument with the heart?
Tedros?
I don't think this will need any response. I can only agree with you and do our best to invest in climate change and health. I am a true believer. My late Prime Minister was leading the negotiation. I don't know if you know him, Prime Minister Meles Zenawi. And that was when I was heartened, actually, when he was bringing the case of small islands. And when he used to say, today it could be them, but tomorrow it's everybody. So you do this not for them, for you. You do this not for the small islands, for us, for all of us. That's what he used to say. There is no difference between today and tomorrow. And that was a very powerful message. And as Minister of Health, I used to participate in his meetings. And he used to bring the example of small islands. It doesn't mean that other countries are not affected. They are. But some are disproportionately affected. And they could lose today. But the whole humanity loses tomorrow. And there was a saying also, I remember, I don't know who said it, the planet can move on with or without us. So if it's going to be about saving the planet, that's not true. It's just saving ourselves. It's saving ourselves. Otherwise, the planet will move on, with or without us. So I think the basic thing is to understand that this is about humanity. It's about all of us. The impact could differ from day to day, but it will be the same tomorrow. So it's about all of us. We're on the same boat, and we have to do everything, as you said, all of us in unison, without no one really void from the table, because this is about humanity and about all of us. And then about the industries who invest in fuel, fossil fuel. Okay, they may see it in terms of the, what do you call it? The profit they're getting today. But this behavior is hyena's behavior, not human behavior, because we think properly. You know what hyena does? When it's wounded, it eats its own wound, thinking that it's somebody's wound or somebody's flesh. Then it eats itself completely, like it commits suicide. When people, one of us, do the same thing, they don't know it. They think they're eating somebody's flesh, but they're eating their own flesh. At the end of the day, it's suicide to humanity, including those guys who are trying to accumulate wealth at the expense of others. It could be at the expense of others today, but tomorrow it's at the expense of themselves. So let's stop being a hyena. Thank you very much. Thank you. Thank you very much. I really enjoyed my stay here and look forward to working with you very closely. And let's do everything to save humanity and to save ourselves. And it's possible, by the way. Everything is in our hands. What is needed is the will to really change our mindset and really stay away from greed. Greed will kill the whole world. Thank you.
So and now I'd like to turn to the Minister of Health from Argentina to start the discussion or continue the discussion. Thank you.
Bien, muchas gracias. Solamente yo quería un poco explicar la situación de la República Argentina en cuanto a cambio climático. Nosotros, primero de hace ya casi 2 años, empezamos un trabajo muy profundo sobre cambio climático. No voy a repetir lo que se dijo aquí, porque vemos que rápidamente se está convirtiendo en una cosa que nos va afectando a todos. Lo primero que empezamos a trabajar es en la intersectorialidad, habida cuenta que salud es solamente un punto de otros ministerios. Esto llevó a que se hiciera un comité al nivel del Gabinete Nacional sobre esto y se creara un ministerio especial para medio ambiente, habida cuenta de la importancia de lo que le damos. La primera actividad que comenzó este gabinete es sobre los diagnósticos de situación y nos dimos cuenta que teníamos una importante cantidad de problemas ligados al ambiente. El primero que afectó a la Argentina fue el ozono, que como sabemos se produce en el norte pero se afecta en el sur y tenemos una alta tasa de tumores de piel por la caída del ozono. El otro punto son las inundaciones. Hemos tenido en los últimos años cada día más problemas de inundaciones por las lluvias que se producen en el área tropical norte de nuestros ríos Paraná y Uruguay. Eso nos ha traído importantes problemas a la Argentina que necesitan de un abordaje. El tercer tema que vimos son los incendios, especialmente los incendios en el área patagónica. Y hasta tuvimos incendios en la ciudad de Buenos Aires, en las afueras de Buenos Aires, con un grave riesgo para toda la población. A esto le tenemos que sumar los factores ambientales dentro de las grandes ciudades. Esto nos hace, entre otras cosas como el tabaco, tener una alta prevalencia de enfermedad pulmonar obstructiva crónica, que se está convirtiendo en una de las enfermedades de mayor prevalencia. Entonces, el diagnóstico nos llevó a la idea de que teníamos que tener un comité para poder adelantarnos a eso y a tener una mitigación rápida después de este. Este comité, que se llama SINAGIR y está constituido por varios ministerios, se ha aplicado directamente y hemos tenido mucho éxito, a tal punto que todos los ministros del gabinete están conectados automáticamente, porque la respuesta muchas veces tiene que ser inmediata y si no se prolonga mucho y nos trae problemas. Esto también nos llevó a crear un área de epidemiología ambiental que Argentina no tenía. Todavía la estamos haciendo, ya tenemos la infraestructura, pero nos falta el recurso humano. No es fácil encontrar, yo soy epidemiólogo, no es fácil encontrar epidemiólogos que sean expertos en esto. No los tenemos en Argentina. Eso es una cosa que le vamos a pedir a la Organización Panamericana de la Salud que nos ayude en este sentido. Entonces, también el Ministerio de Energía y Minería, que están en este área, han empezado a trabajar en la emisión de dióxido de carbono, especialmente de los combustibles. Argentina ha progresado mucho en este último año, especialmente en energía eólica y solar, especialmente en el área de la Patagonia, donde nos ayuda para estas dos cosas, el clima nos ayuda. Otro problema que hemos tenido, que está ligado a este cambio climático, como otros países, es el avance de algunas enfermedades transmisibles que están muy ligados a esto. Ya se ha hablado aquí del dengue, del Zika, del chikungunya. El mosquito Aedes aegypti ha llegado a la frontera de la Patagonia en estos últimos años. Quiere decir que Argentina el año pasado tuvo su epidemia de dengue más alta de la historia argentina, casi 70.000 casos. Quiere decir que va avanzando hacia el sur, a lugares que nunca hubiéramos pensado, y todo esto porque hay una tropicalización con el aumento de la temperatura. Así que estamos avanzando en el diagnóstico precoz y la mitigación, pero necesitamos muchísimo más todavía, y justamente el BID era una de las próximas objetivos nuestros para lograr un financiamiento y ayuda para este tipo de intervención. Gracias.
We just have a few more minutes, are there any other comments, suggestions? I just ask that we keep our remarks relatively short and concise, so please, thank you. The Minister from Bahamas.
Certainly. Thank you so much for putting on this very, very important session. For 6 months out of the year, the Bahamas, while undergoing the mundane reality of existence, is faced with this increasing challenge, not only to our very survival, but our economic prospects, made worse by the fact that climate change and its implications dramatically impacts an economy which is based on tourism. We find ourselves in the bizarre, almost surreal scenario of either praying for or hoping for the influence of the cone of probability. And what that means is that as we stand in solidarity with our neighbors, if there is a shift in that cone, it has implications of devastation for those people with whom we stand. And so, while I thank the Ambassador and Dr. Tam for their very important contributions, we need to make action on climate change a real phenomenon that has the highest priority. Thank you very much.
Thank you, Minister. Any other comments, questions from our audience? Yes, please. Please state your name and where you're
Pilar
from.
Tello, de la Asociación Interamericana de Ingeniería Sanitaria y Ambiental. Yo me voy a permitir por el corto tiempo comentar algunas acciones preventivas que consideramos que son vitales, y me remito a lo que es el agua y saneamiento. Encontramos que todavía el agua y saneamiento en América Latina es lamentable. El 50% de los municipios no cuentan con rellenos sanitarios. Y eso hace que grandes extensiones de tierra con el residuo a veces ligeramente cubierto sigan generando gases de efecto invernadero. Estos gases de efecto invernadero provocan el calentamiento global. Entonces, una de las cosas que yo quiero comentar es la relación tan directa que hay, lo que llamamos una salud preventiva, es la relación en si cuidamos lo del agua y saneamiento, sobre todo el manejo de los residuos, y aplicamos acciones directas sobre eso, vamos a ayudar no solamente a el tema del cambio climático, sino también a cuidar que los vectores no lleguen a problemas de salud. Yo invito a los países a que si tienen que tomar acciones para obras de agua y saneamiento, las hagan no considerando solamente la tecnología convencional, o sea, un relleno sanitario o plantas de tratamiento muy elementales, sino que hagamos el esfuerzo por tener soluciones más globales que permitan apuntar hacia una solución del cambio climático. Muchas gracias.
Thank you. Would any of our panelists like to respond to the comments that have been made, particularly the comment on action?
Thank you.
And then I will turn to Dr. Etienne because we're really running out of time.
I'm going to respond in Spanish to the two members. Quiero resaltar mucho lo que mencionó el ministro de Argentina, que hemos visto desde, como usted bien lo mencionó, el gabinete transversal, lo que ha avanzado la agenda, inclusive el BID como grupo, armó todo el tema de renovar, como usted conoce, que es un muy buen ejemplo de lo que mencionaba. Se armó una estructuración financiera en la que estamos utilizando fondos de Canadá, 130 millones concesionales del Green Climate Fund para el desarrollo de cerca de 800 megavatios eólicos, sector privado en Argentina. Y Tema urbano que usted mencionaba, hoy aprobamos en el banco el crédito para la revitalización de la Villa, Barrio 31, que como usted mencionó es otro gran ejemplo de trabajo multisectorial. Así que creo que usted trajo ejemplos muy concretos en eso. Sobre el tema de salud, si usted tiene como parte del comité algo concreto en especial vinculado al NDC, yo le voy a pedir el favor que hable con el representante del BID en Argentina para ver cómo lo podemos ayudar. Algo muy breve sobre el tema de residuos sólidos. Cuando yo mencionaba que todo está conectado, el tema urbano, gran parte del problema de no tener buenos rellenos sanitarios en la región es que no se da la escala para poder tener, por ejemplo, una concesión privada que se encargue de un buen relleno. Y eso parte por los arreglos institucionales en áreas metropolitanas de una ciudad con sus municipios anexos para poder tener un buen relleno. Parte de lo que estamos empezando a ver en el área urbana del banco es cómo ayudar con esos arreglos institucionales, que si no se da la escala tampoco para poder capturar el metano y puede ser y utilizarlo rentablemente para el tema de energía. México es un ejemplo, tristemente ahora con el terremoto que estamos viendo, vía la parte privada del BID, cómo el metano de bordoponiente puede ser utilizado después para generar energía para el metro de México. Pero de nuevo, la escala para poder tener este tipo de arreglos requiere que la parte institucional urbana también se vaya avanzando en la parte metropolitana.
Thank you, gracias. Ambassador Angus?
Yes, I'd like to thank all of the responders for the very important points. Mindful of the time, therefore, I'd just like to pick up on a point made by our colleague, Dr. Sands of the Bahamas. Getting action. One of the challenges we have as small states and small island states is that we have a plethora of things to do. But when we go to the international community, they say, well, actually, your projects are actually quite small, and therefore, we want to focus elsewhere. So one of the things that we need to do, as particularly for the islands, is to aggregate, to work together in aggregating a lot of projects to actually show the scale and the dimension of and the attractiveness of investing in things like renewable energy in the Caribbean and elsewhere, so that we spend less and less money of our foreign exchange in earnings, in money going outside the country for imported fossil fuel. That would be one of the key ways in which we could change our balance of trade, actually have more money sitting in the country. The second thing, of course, is that we need to mainstream climate in terms of our national planning through all the ministries, and indeed a lot of the institutions sitting around the room need to be doing the same thing, as we've heard from the IDB, and I know the World Bank and others are working on this. But it means now that actually we have to not just mainstream but prioritize, because as we see, when we have these events, we're actually being set back 20 years. I mean, in the case of Dominica, there's a sense there that they've really lost quite a lot, and they've been set back for about 20 years. So we can't just sort of look at these action items as things that we can do further down the road. We need to be doing them now, and that is what will actually build resilience. If you want action, follow the money. If you want money, you need to be able to demonstrate the value, and we can do that as small states by aggregating and working together. Thank you.
Any other comments? Dr. Etienne, would you like to provide some closing remarks?
Thank you, Dr. Danel, and let me...
Obrigada, doutora Danel. Agradeço a todos os painelistas e todos os que vieram a este evento paralelo. Quando o planejamos há algumas semanas, não foi no contexto dos eventos que ocorreram no Caribe e nos Estados Unidos, mas o que ocorreu há algumas semanas estabeleceu o contexto para essa discussão. Quero agradecer a todos que participaram e contribuíram. O primeiro-ministro de Dominica, na intervenção na Assembleia Geral, disse que esta é uma guerra que não pedimos que não iniciamos. E é muito importante isso, porque no contexto dos pequenos estados insulares em desenvolvimento, eles recebem a maior carga da mudança climática e temos que enxergar isso e enfrentar a questão sob esta perspectiva nas nossas discussões sobre a mudança climática. E as oportunidades de financiamento para esses estados têm que também ser vistas desta perspectiva. Preocupa-me que a saúde não tem proeminência nas discussões. Nós não defendemos o nosso lado devidamente. Não vejo os ministros de saúde fazê-lo nos seus países também. Nós temos que ver a saúde incluída em propostas de financiamento. Raramente isso acontece. Parece que somos até meio cegos e achamos que a mudança climática é boa para a saúde. Quando se vê o Aedes aegypti em áreas em que jamais foi visto antes, isso tem implicações para a dengue, para a febre amarela, chikungunya, Zika. Parece que não houve doença suficiente e sabemos todos das sequelas. Quando testemunhamos incêndios, inundações, temos que deixar claro que isso afeta a saúde. Muitas das instalações de atendimento na área de saúde estão perto de rios, enfim. Nós temos que ter dinheiro para recuperar essas instalações, para tornar os hospitais inteligentes. E então, na OPAS, nós temos o projeto de hospitais inteligentes que estamos implementando graças a DIFRID e a colaboração nesse sentido, mas isso não basta. Todas as instalações de saúde da nossa região tinham que ser inteligentes. Então, e as que estão mal situadas têm que mudar de lugar, têm que ser realocadas. É claro que os furacões são situações extremas, mas nós com isso perdemos energia, por exemplo, e com isso as instalações que têm que dar atendimento às vítimas estão com as mãos atadas. Isso não é verdade só no caso dos pequenos estados insulares. Isso ocorre também nos países maiores. Tudo isso tem a ver com saúde, como nos prepararmos para a promoção e a resposta necessária diante do aumento no número de cânceres e outras sequelas devidas à mudança climática. Quero que saibam que eu não estou satisfeita com o que estamos fazendo na OPAS. Confesso que acho que estamos envolvidos demais no nível mundial e regional e não no nível nacional. Já tomei a decisão de que aumentaremos as nossas equipes na região central e do Caribe para que possamos dar assistência técnica melhor. Essa decisão foi tomada em março ou abril. Numa região subregional, eu ouvi o professor na Escola de Medicina São Jorge. Ele acompanhou negociações em nome do Caribe e na América central também. Tomamos a decisão que alocaríamos mais recursos humanos nessas áreas. Nós estamos muito lentos em termos de desenvolver os nossos planos nacionais e vamos apresentar isso na reunião de novembro. Temos 3 apresentações de país: Dominica, Grenada e Jamaica. Estamos expandindo os países com os quais estamos trabalhando nos respectivos planos de saúde e também nós também estamos dando assistência técnica com países que estão desenvolvendo capítulos na área de mudança do clima. Nós temos um curso ainda só em espanhol, que já atingiu 28 profissionais, um curso virtual, e queremos expandir a audiência deste curso. Reconheço que precisamos de maior liderança e maior coordenação em termos da resposta à saúde, mas também em termos de adaptação e mitigação. É nesses 2 pontos que eu gostaria que avançássemos. Eu desafio o BID, o Banco Mundial e todas as fontes financiadoras no sentido de ter que incorporar a saúde nas propostas e no pensamento mais abrangente quando falamos de mudança climática. A economia sofrerá, tudo vai sofrer, mas numa catástrofe a necessidade mais importante é o atendimento à saúde. Todo mundo quer poder ir aos postos de saúde, aos hospitais. E se não estamos presentes, não podemos atender. Vamos ver como podemos colocar a saúde na mesa das discussões. Em novembro, nós teremos um Dia da Saúde, o Dia da Saúde, 12 de novembro, sob a égide da Convenção da ONU sobre a Mudança do Clima, e haverá uma sessão sobre as questões de saúde relacionadas à mudança climática nos pequenos estados insulares. Eu pretendo estar presente e falar alto e bom som, alto, aliás, e bom tom, sobre essa questão. Me parece que já estamos atrasados, mas nós precisamos nos basear no pouco que já foi feito. Muitos países que já se iniciaram estão dispostos a compartilhar a sua experiência, mas temos muito, muito mais a fazer. Exige a liderança da diretora, e isto eu garanto a todos. Muito obrigada, obrigada por terem vindo. Muito obrigada. A conferência se reinicia às 2h30. Com certeza ouvirão muito mais de nós sobre mudança climática.